Hello guys, welcome back to the channel. So this is the part 2 of the Fmge paper that was conducted today, that is on Jan 20, 2023. So we have done around 28 recall questions, so we'll start after that. Okay, so not only I have tried to include the recall question, but the important things that can be asked in your exam for Fmge, this is important because you will know what kind of questions can be made. For NEET PG, this is important because similar type of questions may be asked in your exam. So without delaying, let's get started. If you are new to this channel, please subscribe to the channel for such amazing content. So let's get started. Say first of all they ask you which component is not a part of child Target score. Okay, so see, for child Target score, basically this score is used for severity, guys. Okay, so this is severe, so remember it like this will beep, guys, if it goes more. Okay, so remember B for bilirubin. Okay, E for encephalopathy. Okay, A for albumin, A for ascites. Okay, and P for PTINR. So these are the 5 components, guys. Okay, so you can have a look. Whatever was not in the option would be the answer of this question. Okay, and if it is 5 to 6, that is least severe, and if it is maximum, that is 10 to 15, that is the most severe, guys. Okay, we give the score 1 2 3, 3 being the most severe. So 5 criteria, 5 into 3, 15. Then the next question they ask you about a hemangioma. Okay, around the eyes, guys, you had a red color patch, that is the capillary hemangioma, that is seen in child, that is a vascular tumor basically. Then the next question was of a Gillian syndrome. Okay, so this Gillian syndrome, basically what happens here, this is a lower motor neuron. As a result, you will have weakness and paralysis of the lower limb. Okay, loss of sensation. So this may be due to Campylobacter jejuni or giving a history of vaccination, guys. Okay, so this AIDP, this is the most common type, acute inflammatory demyelinating polyneuropathy. Here you will have paresthesia. Okay, and most cases are caused by Campylobacter jejuni. And see, I'll give you a mnemonic: GBS, Guillain-Barré syndrome. So this is, guys, BS means bilaterally symmetrical, and this goes upward, guys. Remember, it starts distally, guys, and it goes upward. That is important. So if it goes upward, it can involve the respiratory muscle weakness leading to the support of ventilator. And treatment, you have intravenous immunoglobulin and plasma action, IV. Okay, there is no role of corticosteroid. Since it is a low motor neuron disease, you will find absent or depressed deep tendon reflexes. Okay, see, this we have already. And on cerebrospinal fluid examination, guys, okay, you will find elevated protein. Okay, that is important. This is known as, guys, cytological dissociation. That is again important. So this was all about. See, it may be due to predisposing infection or bacterial infection, some GI infection, some viral infection, or post vaccination, like some of them complain post COVID vaccination. Then moving on to the next one, guys. Okay, that is the secondary syphilis, guys. So we know that syphilis, guys, that is caused by Treponema pallidum. So what happens? Syphilis, that is, remember it like a less. So this is a painless ulcer with your painless lymph node. One thing is important that may be asked in your exam. So what did they give, guys? They gave you a condyloma lata, that is on lesion. Okay, and also they gave you skin rashes, guys. Okay, fever, lymphadenopathy, skin rashes. So they are typically seen in secondary stage of syphilis, guys. Okay, and also in one of the question they mentioned the dark ground microscopy for syphilis, guys. That is again important. That may be asked. See, then primary syphilis, guys, you have a painless chancre, and for tertiary syphilis you may have gammas. Then you can have aortitis, that is means tunica intima inflammation. Okay, tabes dorsalis, again important. This is also known as general paralysis of insane. And Agile Robertson people, you need to remember ARP means accommodation reflex present, PRA pupillary reflex absent. This is again important, guys. Okay, so the next thing that may be asked in your exam, guys, okay, is this one, guys. Okay, following antibiotic treatment, guys, you have a reaction that is known as, guys, Jarvis-Herxheimer reaction due to the host response in release to sudden amount of bacterial antigen. Okay, so see, what is the summary, guys? Secondary syphilis has the RAS and condyloma. Latent syphilis, guys, that is non-symptomatic. Late syphilis, guys, you will have brain involvement, cardiac involvement like aortitis and other things, guys. Okay, and this is a non-itchy painless chancre, guys. Okay, and this is a table, guys, saying secondary was the question. You have skin rashes, headache, fever, swollen lymphadenopathy, loss of appetite, guys. That is, secondary syphilis. Now coming on those, this trachoma, guys. Okay, so this trachoma is caused by chlamydia trachomatis. Okay, so WHO has given a strategy, guys, that is known as the SAFE strategy. So S means surgery, A means antibiotics, guys, F means facial cleanliness, E means environmental protection, guys. Okay, so they ask you what is the meaning of S in the SAFE strategy, that is surgery. Okay, for advanced cases. The other thing that I expect that can come in your coming exam, guys. Okay, so if you have a look, guys, okay, that is this environmental protection, guys, that is the primordial prevention. Facial cleanliness is the primary prevention. Okay, antibiotics, early diagnosis and treatment, guys, that is a secondary prevention. And disability limitation and rehabilitation, that is your tertiary prevention, guys. Okay, you may have noticed, guys, today the important, they have given around 3 to 4 questions just from this strategy. Like a question was hand washing, guys. Okay, so hand washing, we are doing health promotion and specific protection, guys. We are trying to protect us, guys. That is the primary prevention. Then the next question they ask you was the Gilbert syndrome. Okay, so Gilbert syndrome, what happens in your Gilbert syndrome? So we have unconjugated hyperbilirubinemia and conjugated hyperbilirubinemia. So remember, doctors are conjugated, that is Dubin Johnson and Roter, guys. D for Dubin Johnson, D for dark liver. Okay, and this is a conjugated hyperbilirubinemia. Okay, that is important. Then this Roter syndrome, guys, they are phenotypically similar, but Roter is slightly milder. Okay, and here you don't have a dark liver. So the question was Gilbert syndrome, guys. Gilbert syndrome is a unconjugated hyperbilirubinemia where you have a deficiency of UGT, that is UDP glucosin transferase. Okay, as a result you have asymptomatic or mild jaundice. Again important, that is relatively common, benign condition, treatment phenobarbital. The next question that they ask you, guys, was the treatment of varicose vein. So we know that varicose vein is the dilated tortuous veins, guys. Okay, and there you have the presence of CAP classification. So how do you treat varicose vein? Either you can do a radio frequency ablation, or you can basically remove the entire vein, guys, that is stripping of the vein, or also you can do a technique known as the sclerotherapy, guys. Okay, so what happens in sclerotherapy? We injecting the unwanted vein with the sclerosing solution that causes the vein to shrivel off, guys. Okay, the most common compound used is the sodium tetradecyl sulfate, guys, in the ratio of 3:1 or 4:1. That is again important. Then they ask you postterm baby. Okay, postterm means pregnancy. So if you see, guys, okay, term is 37 week to 41 plus 6 days. Okay, be very sure, guys, this is the lines, guys, you cannot miss it out. Postterm means it's more than 42 weeks, no confusion here. Okay, now coming on to the next one, guys. Okay, so so they may give pitting of the nails, oil drop sign. Okay, so that is psoriasis, that is silvery gray scales due to air entrapment in between, guys. Okay, and also when you scrape it, you will have auspice sign, that is pinpoint bleeding spots. That is again important. Then they ask you CRO, that is central retinal artery occlusion, guys. Okay, try to think for yourself, guys. If the retinal artery is occluded, what will happen? Blood will go less, that is it will look pale, guys. Okay, do you look, the retina looks pale. As a result, just there is a cherry red spot that is present at the macula. Okay, this I have discussed so many times, guys, in my past video. And you see presence of attenuated blood vessels. Then they ask you, guys, what is the meaning of D in the ABCD? So ABCD, A means airway, B means breathing, C means circulation, D means disability, like checking the level of consciousness, that is done by Glasgow coma scale, and E means environment. Okay, safety, surrounding safety. Okay, then they ask you non-competitive inhibition, guys. Okay, in the last part we discussed about the graphs of non-competitive. So there is non-competitive. Remember, non-competitive, no change in Km and Vmax decreases, guys. Okay, then they ask you if the child is less than 1 year, guys, what we do? We give 1 lakh international unit of vitamin A. Okay, and if the child is more that after every 6 months we give 2 lakh international unit of vitamin A till 5 year, guys. So the next year question may be, guys, okay, what is the total dose of vitamin A given to a child 5 year, guys? Okay, so see, first year we give 1 lakh unit, then every year, guys, we give 2 lakh unit, 2 doses, guys, every 6 months. So that will be in 1 year 4 lakh unit, and 4 year you are giving, guys. Okay, so that will be around 4 into 4, that will be 17 lakh international unit. That may again be tested in your exam. Okay, so so this is about, because till 5 year we are giving, see, first year 1 unit, second year 4 unit, third year 4 unit, fourth year 4 unit, fifth year 4 unit, because we are giving every 6 monthly 2 lakh international unit. Okay, then coming on to the next one, guys, they asked you a question of Burkitt lymphoma, guys. So here the translocation is 814, and here you see the presence of starry sky. So there is a typical history of an African child, guys, adolescent, and translocation involving the Fmge gene on chromosome 8 and 14 IGH. Okay, IG. So here you see the presence of starry sky appearance, guys. Okay, and jaw lesion is classical thing. The next question that they ask you, when do you see the giant V wave? Okay, so see, giant V wave. First of all, know what is V wave, guys. V wave is basically the passive atrial filling. Okay, so what happens, see, suppose this is the right atrium. Okay, so basically this valves are closed, guys, and this valves are closed, but the blood is filling here. Okay, so when the blood is filling here, suppose if there is a tricuspid regurgitation, so what happen, some blood will come here. As a result, due to more blood coming in, guys, pressure will increase. As a result, you will see the presence of giant V wave. The option was tricuspid regurgitation. Okay, then the next question they ask you, that is esophageal anatomical construction site. So that is always calculated from the incisor teeth. So basically, where do you see? So that is the pharyngoesophageal junction. Then you have the arch of aorta. Then you have the, guys, left principal bronchus. Okay, left bronchus, and that is the right crura of the diaphragm. So these are the sites of construction. That is at 6 inch, 9 inch, 11 inch, and 15 inch. The next question that you ask you, that is QSOFAR, guys. QSOFAR is basically to know about the sepsis. QSOFAR stands for quick sequential organ failure assessment score. So here we have three parameters. So how I have remembered, guys, sofa. Okay, so RCB player sitting on a sofa. R means respiratory rate. Okay, C means confused or altered mental status, and B means BP. That is your QSOFAR. So they ask you which one is not a component. Very easy, guys, no confusion, and you calculate the score. If it is more than or equal to 2, guys, chances of mortality are much high, and the patient needs to be shifted, taken care in ICU. Then the next question they ask you about the Trichomonas vaginalis. Okay, so here you see the presence of strawberry cervix, guys. Okay, so let's see the typical flowchart of the vaginal discharge, guys, that your UL gives you. So we have bacterial vaginosis caused by Gardnerella vaginalis. We have trichomoniasis caused by Trichomonas vaginalis, and we have Candida vaginitis caused by Candida albicans. Let's have a look at the color of discharge, guys. Okay, so see, no more confusion from vaginosis. That is that in the name only, guys, they are giving no, means this will have no inflammation. Okay, no confusion. Rest does not have no in their name. Okay, so that is, guys, inflammation would be present here. Okay, no confusion from now on. Then coming on to, guys, discharge. This bacterial vaginosis, you have thick off-white color discharge with fishy odor discharge. That is important. Then trichomoniasis. Here you have this trichomonas. This mona is yellow green. Okay, and you have malodorous frothy discharge. Candida, guys, whitish cheesy discharge, everyone knows. Then coming on to lab findings, guys. Okay, we know that this bacterial vaginosis follows the criteria, guys. That is your Amsel's criteria. Okay, so you have components in Amsel criteria, that you have positive whiff test with 10% KOH. pH is more than 4.5. This is very, very important, guys. Okay, because here the pH is more than 4, and here you see the presence of clue cells. So these are the clue cells, guys. Okay, bacteria is stuck around all around them. So treatment, you have either metronidazole or clindamycin. Then coming on to trichomonas, guys. Here you see the presence of motile trichomonas. Okay, and treatment again metronidazole. Then coming on, guys, to the candida. Okay, that is thick cottage discharge. Here the pH is normal, you see the presence of pseudohyphae. And if you know vaginal discharge, guys, that comes under the kit 2. That is, guys, which color kit? Green color kit. And what was there in the green kit, guys? That is secindazole and your fluconazole. Okay, what is the dose, guys? Can you recall for me? Secindazole was 2 gram stat, and fluconazole was 150 mg. Okay, moving on to the next question. That is your herpes simplex, guys, virus. Okay, so how the herpes simplex has typical history they will give along a dermatomal spread. That is a herpes simplex infection, that is shingles. Okay, so this was the question. Now coming on to the next one, guys. Okay, they ask you which mineral is deposited in eye. They gave you a history of diseases affecting liver and brain. What is affecting? So when there is liver and brain, guys, think of hepatolenticular degeneration. That is, guys, Wilson disease. So when we talk about the Wilson disease, guys, this is affecting the ATP7B located on chromosome 13, guys. Okay, this is also a PYQ. There is decreased copper incorporation into the bile, excretion into the bile. Okay, that is again important. So the patient may present with liver failure, hepatitis, neurological disease like dysarthria, dystonia, Parkinsonism, and this is the classical photo in the eye known as the Kesher-Fleischer ring. That is important. And where the copper deposited, guys, this is deposited in the 4th layer, that is your Descemet's membrane of the cornea. Again, treatment, guys, you need to chelate the excess copper. That can be done with, guys, penicillamine, zinc, or something like this. Okay, then they ask you an image of linea nigra. Okay, so basically this is the sign in pregnancy. Okay, this due to increase in melanin. Okay, preopiomelanocortin. Then they ask you the investigation of choice for hyperparathyroid, guys. Okay, so this is a must know point from radio, that is your system EV scan. Then they ask you mutation of sickle cell anemia. So we know that like sickle cell anemia appears like this, that is sickling of the cells, guys, also known as drepanocyte. So here the mutation is at the beta chain of the 6th position, where GAG is replaced by GUG, that is glutamic acid is replaced by your valine. Now moving on to the next one, guys. Okay, they give you an image where they ask you a pelvis shape. So many of them are saying gynecoid pelvis, many are saying platypoid pelvis. Okay, unless and until you give correct image, it's practically not possible. So see, this pelvis shape is in accordance with your Caldwell-Molloy classification. Okay, so he has given, guys, this shape of the pelvis. Okay, so see how he has described the shape. We will have a look. Okay, see, if the pelvis is round, guys, okay, that is your gynecoid pelvis. This is the most common pelvis and it favors easy delivery, seen in maximum population. Then this android, guys, okay, this is the heart-shaped pelvis if you have a look, okay, and this is seen in males. Okay, this platypoid pelvis and anthropoid pelvis. So see, anthropoid very easy mnemonic, AP, that is, this is antero-posteriorly oval. This platyploid pelvis, guys, okay, this is a transversely oval, guys. You can have a look. Okay, so depending on the guy's image, you can have an answer. Okay, if it is gynecoid, guys, that would be round in figure. Okay, platyploid, that would be transversely over. Then coming on to the next question, they ask you, okay, they give you an image of juvenile angiofibroma. So remember, guys, this juvenile angiofibroma is seen in young boys. Remember, this is seen only and only in boys. Okay, that also around less than means 10 to 12 years. Okay, most common site benign nasopharynx. Also it may be seen in sphenopalatine foramen. See, this is a vascular tumor. Okay, and here the most common blood supply is the sphenopalatine artery. Since this is seen in boy, adult male, this is the androgen dependent tumor, and here you will have features of nasal obstruction, swelling in the cheeks, okay, and recurrent epistaxis. That is again important. So here when you examine it, you may have the proptosis, okay, and also the frog face deformity. Then on CECT, that is, this is your antral Hallman sign. Okay, this is again important. Okay, that may again be asked, guys. Okay, then you have Miller's sign, Hondusa sign, and biopsy is absolutely contraindicated since this is a vascular tumor. It will bleed. It does not also show response to epinephrine. And treatment, you have endoscopic excision. That is again important. Now coming on to the next one, guys. Okay, they ask you medial epicondyle and nerve injury, guys. Okay, I have already discussed in the last part, that is unlearned now. Okay, myasthenia gravis, guys, treatment neohistamine. Then cherry red poisoning, C for cherry red, guys, C for carbon monoxide poisoning. Hand washing, guys, a method of primary prevention, already done. Then some of them suggested minimal change disease also. So this minimal change disease is seen in young child. Okay, that is around less than 5 years. They show excellent response to steroid, guys. Okay, and why the name minimal change, guys? Because there is no change in light microscopy, no change in electron microscopy. Only it shows, guys, effacement of the foot process of the podocyte. That is important. Effacement of foot process of podocyte. The next question that they ask you, guys, okay, that is zinc smear in herpes simplex virus, guys. See, here you see the presence of 3M, that is multinuclearity, margination, and molding. Okay, now moving on to the next one. Okay, that is, they ask you a question where they showed that JVP increases, guys. Okay, that is Kushmu's sign. Okay, and normally what happens, JVP falls with inspiration, okay, and increases with expiration. So this classical case, guys, is a case of constructive pericarditis. This is a photo taken from your Harrison, the world famous book. So see, Cosmol signs is present in constructive pericarditis. Okay, and here, guys, this is important. You need to differentiate between tamponade and constructive pericarditis. So tamponade shows absence of Kussmaul sign. Tamponade shows prominent X wave. Okay, this shows both waves prominent. This is again important, guys. Okay, then the next question they ask you, propaganda. Okay, many were confused where is this question from. So this question is from PSM. Okay, so this propaganda and education, guys, these are two topics PSM has described side by side. So let's see. See, propaganda, this basically things like someone, what happens here in propaganda, someone is basically forcing you, someone is putting something in your mind. Okay, So this is instilled in the minds of people. As a result, you instill, people are not allowed to think, guys. Okay, prevents ready-made thinking. Okay, and this will stimulate primitive desire, and the patient will be aggressive, reflexive behavior. Patient will be appeal to emotion. उसने मुझे मारा तो मैं क्यों छोड़ूं? That is something like this propaganda. Knowledge patient is thinking on what to do, guys. That is important here. Okay, so that is important. So, and here the knowledge is spoon fed. That is again important. And here the knowledge is information centered. You are not giving them chance to think. You are just giving them information and saying do this, don't think, guys. Okay, so that is important. Then coming on to the PUD audience. So this PUD audience, guys, this is basically due to the blockage of subareolar lymphatic plexus, guys, due to meds. As a result, what happened due to infiltration, guys, this goes inside, leading to nipple like retraction. Okay, that is again important. Then they ask you which one is not a micro element, guys. This calcium, which is required for contraction and so many things, guys, it cannot be a micro element. Okay, but this copper, iron are micro element. Then they ask you a post exposure prophylaxis of rabies, guys. Okay, so rabies, guys, we already discussed. We had isen regimen and the thigh regimen. So isen is a 5-letter word, okay, and this thigh is a 4-letter word. So here we give the 4 letters, so we give 4 doses, that is 0, 3, 7 and 28. Isen is a 5-letter word, so we give 0, 3, 7, 14 and 28. Okay, this is a 4 letter, so we omit the 4th dose, that is 14th is omitted here. Then next question they ask you placenta. Okay, that is on some day which placenta will be formed. So see, remember, guys, first of all we have dichorionic diamniotic, then we have monochorionic diamniotic, then we have monochorionic monoamniotic, then we have conjoined twins, guys. Okay, so this depends on when there is cleavage. Okay, so see, if there is cleavage on the day 1 to 4, that is a dichorionic diamniotic. See, monochorionic diamniotic, how I have remembered? I have remembered MACD, that is you eat MACD, guys, not so much. Okay, that is 4 to 8 days. Okay, MACD. Then monochorionic monoamniotic, that is around, guys, 9 to 12 days. If it is more than 12 days, that is your conjoined twins. Okay, that is again important. Then coming on to mechanism of action of labetalol, guys, that is both alpha and beta blocker. Then they ask you nitric oxide, arginine, guys. Then similar question like melanin, guys, you had. So which is that? Then serotonin, tryptophan, guys, like simple question, melanin with tyrosine. Then von Gog's disease, guys, that is due to glucose 6 phosphatase deficiency, and it is a type 1 of glucose 6 type 1 glycogen storage disorders, guys. We have already discussed this. Then they gave you a measles rash, guys. If you look at the image, guys, can you have a look of conjunctivitis, guys? So this is key point how you need to identify in the exam. So measles shows the presence of 3 C's, that is cough, coryza and conjunctivitis. So you can identify a case of measles. Then they ask you, guys, what would be the level of means uterus just after the delivery, guys. On first day it's just approximately near the umbilicus, guys, and by the week 6 it returns to its non-pregnant size, and after delivery uterus weighs around 1000 gram. Then the next question they ask you BRCA12, guys, so it can cause both ovarian and cancer malignancy as given in first aid. The next question that they ask you, that is Gasbox syndrome. Okay, so this Gasbox syndrome, okay, what happens here? This is basically a stress polycythemia which is associated with hypertension, but here you don't have splenomegaly. Okay, so here you have a decrease in plasma volume, and that also chronically. Okay, that is again important. So then the next question they ask you, after vasectomy how much days you should use burial method. So what is vasectomy? Basically you cut the vas deferens, so that this is a permanent method of sterilization. So see, even after cutting the vas deferens up till 3 months, okay, you can have the semen in the sperm. So what do we do? At least after getting 2 negative reports, you should stop using. Okay, that is minimum of 3 months. You should at least use some other method, that is 12 to 16 week or 20 week, whatever was the option. The next question that they ask you, arrange the lochia in order of sequence, guys. Okay, so remember the mnemonic, guys, Racila. Okay, that is RU for rubra, SC for serosa, LA for alba. Okay, so see, first of all think for yourself. Rubra, name indicates it would be red in color, guys. Now suddenly from red it won't go immediately to white. It will be something in between color, that is pink to brown color. Then whitish to yellow color would be alba. Then moving on to next question, guys. So this is again very confusing. Some of them is saying low-lying placenta, someone saying marginal placenta. So see, let's see the concept, guys. Whatever be it, we can easily answer then. See, low-lying placenta. Here the placenta lies in the lower uterine segment, but its lower edge is not near the internal os. Okay, that is around 0.5 to 1 2 centimeter away from the os. Grade 2, that is marginal placenta. It thus touches the margin of the os but do not cover it. Grade 3, partial, that is partially cover the os. Guys, have a look. Here just touches the margin. Here there is a gap, guys. Okay, 1 to 2 centimeter. Here do not touches. The next question, guys, that was a Bell's palsy. Okay, so what happens here in the palsy of the facial line? We have upper motor neuron lesion, guys, and lower motor neuron lesion. So have a look, guys. When you have a look, upper motor neuron, remember upper motor neuron spares the upper half. Okay, so only the lower half will be affected, and this will cause paralysis of the lower face of the opposite side. That is important. Lower motor neuron will cause ipsilateral paralysis of the same side. Again important, guys, this is very common finding that you see in your stroke patient if you go to your wards. Okay, in upper motor neuron facial paralysis, guys, on the facial side, on the affected side, guys, what will you see? So this is the upper motor neuron. Okay, so you will have obliteration of the nasolabial fold, drooping of the angle of the mouth. Okay, with dribbling of saliva, accumulation of food within the cheek, inability, all the features of basically facial nerve paralysis. In lower motor neuron palsy, also this part will be affected. So you see there is a absence of frowning here. Okay, then inability to close the eyes. When the patient closed, it rolls upward. That is known as Bell's phenomenon. So now coming on to the next one, guys, they ask you the structure of nose. Okay, so they ask you cartilaginous and bony guys structure. Okay, so this bony part, upper 1/3 is bony part, then the rest, guys, is the cartilaginous part, like your alar cartilage, guys. Okay, U-shaped cartilage, medial crura, lateral crura. Okay, then they ask you most abundant antibody, guys. So IG antibody, because it's present in the mucosal secretion, guys. Hence this antibody is the most abundant antibody. Then they ask you image of papilledema. Like similarly they ask you like central retinal artery occlusion. So basically here you see due to increased intracranial pressure there is a swelling of the optic disc, guys. Okay, that is your papilledema. Then they ask you a history giving the pheochromocytoma triad. So remember PHG. Okay, that is P for palpitation, H for headache, E for episodic sweating. Then the next question they ask you, guys, lady with allergy with aspirin, guys, and nasal polyp. That is, guys, no confusion, that is a Semter's triad. So how to remember the Semter's, guys? SAM, make it ulta, go opposite side, guys. That is MAS, remember NAS. NAS for nasal, AS for asthma, AS for aspirin sensitivity. Then they ask you, guys, intrinsic pathway. So if the intrinsic pathway is related to apoptosis or they ask you bleeding, be sure. Okay, if it is apoptosis, guys, the option will go extrinsic, that is 8 and 10, guys. If it is due to bleeding, guys, okay, so extrinsic pathway, guys, see intrinsic pathway, here you have 12, 11, 9. So remember the mnemonic 10. Okay, here if you see, guys, you have 7 and 3. Okay, that is 7 plus 3 is again equal to 10. So they ask you extrinsic pathway, that would be factor number 7 ka effect. Okay, so I think that was a bleeding question, so 7 would be the answer here in this question because it was a bleeding question. Then they ask you teacher with a vocal nodule, guys. Okay, so vocal nodule in a teacher, remember they are always bilateral nodules. Okay, and this is what happens due to the repeated use, like vocal abuse in screamers or singer. So there is a vocal abuse leading to hemorrhage and submucosal edema, which will heal with hyalinization and fibrosis. As a result, this leads to the formation of nodules. This is again important, that may be asked, guys. So guys, this is all about today. If you like the discussion, guys, please do comment, like, share and subscribe to the channel. If there are any new option suggestion, you can put it in the comment. Would be really help to those watching later, guys. Thank you, guys. Thank you, guys, so much. Hope you had a good exam. So best of luck, guys.